Welcome to Mayo Medical Laboratories Hot Topics. These presentations provide short discussion of current topics and may be helpful to you in your practice. Our speaker for this program is Dr. Rajiv Pruthi, an Associate Professor of Medicine at Mayo Clinic in Rochester, Minnesota, as well as a consultant in hematology and Department of Laboratory Medicine and Pathology. Dr. Pruthi presents a case study to demonstrate the importance of selecting the correct test. Dr. Pruthi, thank you for presenting with us today.
Thanks for the introduction. I have no disclosures that pertain to this presentation. As you view this presentation, consider the following points regarding testing for thrombosis and anticoagulation. How will the testing be used in your practice? When should the tests be used? What are the factors that affect results of these tests? And of more and more importance lately, how will results impact patient management? We'll begin with a case history. A 69-year-old male with a long-standing history of atrial fibrillation, for which he has been taking warfarin. Recently, he was found to have a colon cancer. Warfarin was interrupted for the colectomy, and it had not been resumed after his surgery. 10 days after his surgery, he presents with left leg swelling. This illustrative case represents multiple facets of clinical and laboratory issues that are relevant to daily patient management. As an example, here we have a patient with atrial fibrillation. The decision points at diagnosis include indication and choice of anticoagulants to prevent stroke. In addition to long-term anticoagulant management in anticoagulation clinics, up to 10% of such patients will require an invasive procedure, which raise peri-procedure management issues, such as indications and options for bridging anticoagulation. The patient also has a malignancy. This population of patients is at high risk for venous thromboembolism. Considerations for this situation include approaching the diagnosis in the most cost-effective manner and choosing the most effective therapy, balancing the safety and efficacy for optimal patient outcomes. Availability of novel direct-acting anticoagulants has resulted in an improved margin of safety for our patients. This, however, has impacted laboratory coagulation testing, which will be reviewed at the conference. Finally, long-term management for patients with thrombosis is best accomplished with a multidisciplinary team of specialists that includes nurses, pharmacists, nurse practitioners, physician's assistants, physicians, and of course, the laboratory professionals. Now, coming back to our patient, let us review his outcome. Since the patient had a high pretest probability of a deep vein thrombosis and he had recently undergone surgery, a D-dimer was not performed as the initial test. Instead, a Doppler ultrasound confirmed the presence of a deep femoral vein thrombosis. Given his need for ongoing anticoagulation for atrial fibrillation and his recent deep vein thrombosis, he was initiated on oral apixaban, also called Eliquis, which is an oral direct factor Xa inhibitor. As you can see, this case represents many different aspects of anticoagulation and various medical conditions such as atrial fibrillation and venous thrombosis. At the next clinical and laboratory update in thrombosis and anticoagulation, we will address multiple different aspects in the diagnosis and management of coagulation disorders, including venous thromboembolism and arterial thrombotic disorders such as stroke and coronary artery disease. We will also address the different aspects of anticoagulation, their risks, benefits, and especially the laboratory aspects. Based on the feedback we have received over the years, we have made modifications to the annual course. New for this year's course are the breakout sessions, scheduled for Friday morning and afternoon. Given the unique needs of different groups of individuals attending the course, which include clinical care providers, laboratorians, pharmacists, and advanced practice providers, we have 3 simultaneous sections titled Challenging Cases for Clinicians, Challenging Cases for the Laboratorian, and Management from the Pharmacist and Advanced Practice Provider aspect. In the afternoon, we have 2 simultaneous sessions, one of which addresses unique aspects of pregnancy and thrombosis, and the second will address aspects of laboratory testing and guidelines. Thank you for your attention, and we hope to see you at the course.